Good morning. Welcome to Wonderfully Whole Conversations, where we feature people who are living a wonderfully whole life and helping others to live a wonderfully whole lifestyle. And today I am so excited to have Dr. Marcia Harris. She's a gynecologist.
Marcia Levy, EPR, HQGH.
She's a gynecologist, and she's going to speak with us and address women health issues. And today, Dr. Marcia, welcome. I thank you for taking time off from your very busy schedule to come and have a very informative and intriguing conversation with us. And the purpose is to help women concerning their health issues. Now, before we go into our conversation, I want to read a little bit about you because you have quite a lengthy bio, but we're going to just touch on some of the things in your bio. You have for over 35 years, you have been an obstetrician and gynecologist. You have delivered babies for over 27 years and worked with women for another 8 years, and you demonstrated leadership through long-term academic appointments, publications, and professional activities, extensive peer recognition for outstanding work in adolescent services, pregnancy prevention, menopause treatment, and for the last 22 years, wellness and preventative as well as anti-aging medicines. You're a New York State licensed physician, New Jersey State licensed physician, and you're a diplomat on the National Board of Medical Examiners. And I want to read a little bit about your affiliations. I have your affiliations right here. I have your affiliations. But anyway, we're going. You're affiliated on so many different boards. And now you are the medical director of the Wellness Restoration Center, and you're doing so many groundbreaking treatments that we're going to discuss that too. So as we go into our conversation, I love to ask, especially doctors, who I have interviewed, what made you go into the study of gynecology, and to practice this, you didn't just get up one day, and decided to do it. What was your why?
Hi, Judy. First of all, thank you so much for having me on your platform today. What made me go into gynecology? It's going to sound trite because a lot of people say things like this, but my mom died. My biological mother died in childbirth when I was 7 years old.
My God.
So at 8 years old, I said I wanted to be, actually, I used to say surgeon. I didn't know the difference. I wanted to be a surgeon so that other little boys and girls would not lose their mommies, quote unquote. Now, I'll tell you, that lasted 3 or 4 years. Matter of fact, it lasted almost through high school. But then when I went to college, I was a speech and drama major. I was going to be on Broadway, but
But
I
thank
couldn't
God you
sing.
didn't.
I couldn't sing. So I'm back.
Well, thank God you didn't, because so many people would have missed out on, your practice, how you're helping them, So we thank God, yeah, we have a destiny. God has a destiny for us, and your destiny was gynecology, to be an obstetrician, and now you're helping people in the wellness field, anti-aging. We're going to talk a little bit about your restoration center, because your restoration center, your mission is to empower people And I love this mission statement. It says, we know that good health is the foundation of a fulfilling life, and achieving it, it should not be a confusing puzzle, which is great. We combine the precision of modern science with the wisdom of traditional care principles and aim to empower you with personalized health and wellness strategies. Your journey is unique, and your healthcare should reflect that. And I love that mission, and I am a recipient of that mission. Now, in the age, my audience is 40 and over. I help women steer their bodies, uh, 40 and over. And in this age where there are so many women are being misdiagnosed or overdiagnosed. I was just listening to how some people overdiagnose, meaning that they got treatments that they didn't need. We want to be educated, as you said, to make the right decisions concerning our health care. So I want to start off with some questions, and then I have two other questions some people send in, and then I want you to go into how you are helping people presently. You know, okay. So the first question is that I wanted to, how often should people get pelvic exams, pap smears, and everything that go into helping us women to remain healthy with our reproductive system?
Well, that's a very good question because the government gets into healthcare now, where they stipulate how often you should get things done. For example, people will come in and say, "My doctor told me I'm over 60. I no longer need a pap smear." I mean, that is just crazy, you know, because it's not that it's as frequent that there's going to be a problem, but there's still the possibility. As long
Yes.
as these organs exist in your body, something can still happen to them. So you really still need to be checked. So, in answer to your question, you need to have regular exams. How often and with what regularity would depend on what's going on. If you're absolutely healthy, a yearly exam should be fine. But that
Okay.
yearly exam is still necessary, even if you're in your 70s. Matter of fact, even into your 80s.
Oh, this is good
Even
because
in your 80s, a yearly exam is still necessary because everything, as long as everything is still there.
yeah, that's true. And that was one of the questions someone sent to me. If you are 70 and you have no health issues, should you have these annual exams? And I'm happy that you said that we once we have our organs, we should continually just have these exams.
That is correct, Judy, because, it doesn't go away. And the thing is, the sooner you find something, the better you're able to take care of it. Now, what I'm
Yes.
doing now is as much preventative as it is fixing. I'd rather prevent than fix. So
Yes.
if you see me and I can say, well, this person has uh, deficiency in something, we can correct it.
Yeah.
But you have to look for it in order to find it. Okay. What happens now is most doctors don't look for anything. I took my 80, how old is she? 84-year-old aunt to the doctor, and she literally did not touch her. She didn't touch her. She never put the stethoscope on her chest. She never listened to her lungs. She sat at the computer, asked me questions, typed into the computer, And 10 minutes later said, okay, I'm going to have them draw blood and da 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 da, and walked out the room. And I shook
It's,
my head.
it's so impersonal.
Never touched her. She never touched her.
So if something was going on with her body, and
You never
she
know.
wouldn't know, you never know.
That's correct.
Yes. Now I want to go back a little bit, uh, Dr. Marcia. Like you delivered babies with 27 years. Tell me a little bit about that.
Oh, it was absolutely amazing. I mean, it's so interesting and so amazing bringing a life into this world. I mean, and it's so
Yes.
funny because every single delivery was an experience all over again. Every delivery. It was like when, I used to run the summer program at Cornell Medical School. They had a minority program for college students. And I remember one year, one of the, I literally, I was at the hospital for about 4 days, 4 straight days. I had 5 deliveries. I had an emergency hysterectomy. I had a pregnancy, a ruptured pregnancy in the tube. I mean,
Wow.
I never got to leave. Now I left that after that 4 day session and went directly to the session with the kids. So the
Yes.
dean said something and said, "Oh, Dr. Harris has been here for 4 days and da 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 da." And one of the students asked, "But weren't you tired? How did you feel? When that baby came out at 3 o'clock this morning, weren't you just tired and whatever?" And one of the senior medical students who was assisting with the course said,
Yes.
Hold it. I'll answer that. I'll answer that." Warrior says, when that baby came out, she says, "I wasn't there this time. But when that baby came out, when the baby comes out, she goes, it's a girl, it's a girl, it's a girl, it's a girl, it's a girl." And the student did this like crazy. It was the most amazing, amazing, amazing experience. And, it's also funny because I didn't do a fellowship in maternal fetal medicine. I had what was supposed to have been a regular OBGYN practice, but for whatever reason, I ended up being a high risk specialist. A lot of Black women have fibroids. A lot of Black women have pregnancy problems, trouble with their cervix, holding the baby in, trouble getting pregnant, all of the above. And everybody used to come to me for what, literally. And it got to the point where even though I wasn't specifically trained in it, I had the equivalent of a really, really high risk practice. So, yes, it was amazing, absolutely amazing.
I'm happy that you brought this up because about Black women concerning, high risk health issues that is misdiagnosed or they don't get uh, sufficient help. Like I heard maybe 2 years ago, and the Olympic girl, she had a high risk pregnancy. She went to the hospital and they sent her home and then she ended up dying. So talk a
They
little bit
sent her
about this.
multiple times. And that the healthcare disparity is real.
Yes.
Healthcare disparity is real. And it doesn't matter. You would think that somebody who is, economically disadvantaged or something like that is going to have that problem. But here, as you point out, I mean, that woman accomplished
Yes.
PhD. I mean, she was up there, but because she was Black, they did not even listen to her. They literally didn't listen to her. Look at when Serena Williams had the first baby. Same thing.
Yes. Yes.
Again, she went in. Something is wrong. They sent her home as well. And it wasn't until she went back the second time that they actually took the time to listen and look. And that is something that as minorities we face all the time. All the time.
So we need to find doctors, especially OBGYN, GYN doctors who would really take the time to listen. And as you say, touch you. I want to bring this thing up too, because many years ago, my sister, uh, her stomach was, rising. Okay, and she had gone to a doctor similar to the one that you took to your aunt, never touched her.
Even
And
though she had the complaint of that she
yes,
presented with. It's
yes.
amazing.
And then she went to a primary doctor who began to examine her and touch her, and he said, "You have fibroids. You need to take care of it." Imagine she was going to this doctor all the time, never touched her, but
Yeah.
she went to a primary physician who listened and touched her body and said, you have fibroids and you should take care of it.
Yeah, it's actually I am concerned for the state of medicine because literally now if they don't have a test, they can't tell you anything. We don't know how to diagnose anymore. 50
Mhm.
years ago when I was trained, I could diagnose anything. I did tests for confirmation, not for diagnosis. Now they use tests for
Yes,
diagnosis. They don't know, nobody knows how to diagnose anymore. All they can do is the tests.
yes, they send you for a blood test and that's it. And
Blood
sometimes,
test, x-ray, whatever, whatever. Nobody thinks, nobody can examine you and come up with a diagnosis anymore. It really is pretty sad, you know. And then again, as I said, minorities are at the bottom of the barrel and they don't even listen, number one. And if they listen, they don't, they doesn't compute. It's almost as if they don't care.
yes. What do you see like a solution for this? Like you have been trained 50 years ago, and you have picked up a lot of wisdom. You have a lot of wisdom in this field.
Find a doctor who will listen to you. Find a doctor who will listen. Okay? See, now another part of the whole thing is the whole insurance thing.
Yes, that's big.
Right? That's another part of it. And some of it I can't argue with because whereas we used to be able to take the time, now what's happening is it's almost like a quota system. They give you a certain amount of time to see the patient, and it's not adequate.
So the insurance companies are,
Insurance companies who is dictating the type of care people get.
it's sad. It's sad. That's why we thank God for doctors like you who are able to, you are in preventative medicine. I call preventative medicine. We don't want to wait until something bad happen and then we looking to treat it. We thank God that there are so-called cures to take care of it, but wouldn't it be good to pick up something, prevent
Don't,
that from
don't
happening?
wait for it to get broke. Make it
Yes,
not happen.
make
You
it
know,
not happen.
that's number one. And then what we do in integrative and holistic and functional medicine is we try to find the root cause so
Yes,
that we can actually fix the cause as opposed to most physicians who really give you a pill to take care of the symptoms. You know,
yes,
all you're taking care of is the symptoms. That's all those pills do.
yes. And some of those give you side effects too. Now, uh, Dr. Marshall, you practiced for 35 years being an obstetrician and gynecologist. And then in our conversation, you said you retired. Talk to me a little bit about this and how you came back into the
Well,
wellness field.
I retired for 3 months. I was burnt out. I was actually burnt out. And this was like about 10 years ago. And I was on my way in. It was a Friday morning. On my way into the operating room, I had like four major cases in the operating room. And I literally driving in, I live in New Jersey. I practiced at Cornell at New York Hospital. And I literally am coming over the George Washington Bridge and I'm like, at your age, why are you still doing this? I mean, and I questioned myself the entire way. I went in, I did my cases, and at the end of the case, the last case, I went to my locker, cleaned it out, went out to the desk and said, Nubia, locker number 249 in the first doctor's lounge is empty. You can reassign it. And she said, what do you mean? I said, I'm not coming back up here. And just every head in the nurse's station turned around, every head, and looked like as if to say, she didn't just say that. You know, I never went back up there, not even to say goodbye. I never went back up there. And that was like October. I took the next 3 months and I closed down my practice to the point of even selling the physical space. And I retired for 3 months. I lay on the beach in St. Lucia for a month, and I lay on the beach in Jamaica for a month. I came back, I ran around New York and New Jersey for a month, and then I said, okay, now what do I do?
So that
So,
was a defining moment for you
yes,
in your life.
absolutely.
Yes. So after the 3 months that you retired,
What
was
did
that
I
how?
do?
Yes. What did?
Well, I decided because I wasn't going to go back into OBGYN. I was not
Yes.
going to deliver babies. I was not going to operate or whatever. And that's when, now let me say, I've been trained. I mean, it's been 26 years, almost 27 years since I've been doing bioidentical hormones.
Yes.
And a matter of fact, I brought bioidentical hormone pellets to the New York, New Jersey area
Yes.
27 years ago. So
Mhm.
it's not that I had been training in the holistic and functional stuff all along anyway, in
Yes.
addition to the regular practice. So when I came back, I actually do just the holistic and functional stuff. I no longer, operate or that type of thing. So
And I love that, to be able to go to a doctor who is conventionally trained, like you went to Cornell, you were trained in Columbia, you're conventionally trained, but yet you are working on the holistic and the functional medicine that some of the conventionally trained people don't even want to look at.
allopathically trained physicians literally have no clue about the cause.
Yeah.
For example, vitamins. Do you
Yes.
know Columbia is one of the top 10 medical schools in the country? Am I correct?
Yes.
We had one lecture on nutrition.
Wow.
We had a year's worth of pharmacology. I can take a drug now, I can tell you its structure, I can tell you its generic makeup, I can tell you its side effects, what it does, what it interacts with. I can go down the line because that's what they teach you.
Yes.
Nutrition, which is the basis of our existence. We
Yes.
had one lecture.
Wow.
Now, there was a nutrition course, it was separate, nobody took it. But we had a year's worth of pharmacology from 9 to 12 every day, 5 days a week for an entire year on the drugs.
And no nutrition. Which brings me to the question, some women are going into menopause, or they're into menopause, and they have all these sleep issues, mood swings, sweats, and hot flashes. How does nutrition play a role in helping that? I know we're going to talk about the bio-identical. I want you to talk about that after, but as the nutrition comes up, tell me how can this play a role in reducing some of these symptoms?
Well, okay. Everything comes down to our cells.
Yes.
And the cell is the functional unit of the body. Whether it's your skin cell, heart cell, brain cell, blood cell, the cell is the functional unit of the body. So basically, we literally have to cater to and take care of ourselves. And what we know now, which was not that prevalent or that well known back then, is that we, our lifestyle is so critically important. And of course, nutrition comes into lifestyle.
Yes.
You know, you have to live just as we knew that smoking was bad for you. One cigarette kills about 60 billion cells. One. So by the time somebody smokes a pack of cigarettes in a day, they have literally killed 60 trillion cells. You know,
Yes.
we know that. And now cigarette smoking is not as prevalent as it used to be, etc. Well, that's only one example because what we eat, what we drink, how we exercise, our how we take care of our bodies, okay, including what we put in, is very, very, very important because that's what determines what happens with our cells.
Yes. And you see that in menopause, some people go through some terrible menopause. They have a terrible menopause journey.
Well, 80% of women who, when they go through menopause, have some sort of symptoms. 20% don't. Now, here we go again. Women are treated like second class citizens because they have not taken the time or done the research, okay, and given us the information. We're just now getting all of the information that we need. But here we go again. We come back to your cell. We come back to the cells. We, as women, okay, your great grandmother, your great 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 grandmother and mine didn't live past 50.
Yeah.
The average age of death, because there was no antibiotics to treat infections, women died in childbirth because if the baby was too big or if there was a problem or whatever, you lost mother and baby, that type of thing. Women did not live past 50. Average age of death was 50. Now the average age of death for a woman is 86. All right. And for a man is 79. Now, by the way, that difference is critical because we live longer because we're protected by our hormones. But you said
Yes.
we're going to come back to that. We'll talk about that when we come to that. But
Yes.
our cells, we have to take care of them. And you do that by lifestyle, eating right, exercising, drinking water. Every cell in our bodies is up to 70% water. And just
Yes.
as you don't bathe in the same water every day, you've got to flush the cells. So you've got to drink enough water for that. Sunshine, vitamin D,
Yes.
okay, is one of the major sources of getting vitamin D. Vitamin D is critical to our existence. It's the basis of our immune system. All right?
Yes.
Sunshine, adequate rest. A lot of us don't get more than 3 or 4 or 5 hours sleep at
Yeah.
night. When we sleep, when we rest, That's when the cells regenerate. That's when the cells heal themselves. That's when you get rid of the bad cells, and that's when the new ones come in. All of that is done during sleep. Sleep is very important. All right? Even breathing, how we breathe. Most of us, we breathe so shallowly, we never ever expand all the alveoli in our lungs. We never
Take a
get
deep,
all the
yes.
way back to the diaphragm. We go, and we're breathing with the top part of the lungs, and the lung cells below that never get expanded, never get open. It's, it's a process, and it's a process we need to know and that we need to do. Lifestyle. Remember
Lifestyle.
that word. It's totally and
Yeah,
critically important.
I agree. Now I want you to touch a little bit on the bioidentical hormones.
Well, okay, let me talk about hormones in general, because as I
Yes,
said, the female hormones are the reason we actually live longer than men.
yes,
Our hormones are integrally related to and tied into at least 400 functions in our bodies. There are
yes,
hormone receptors on every single cell in our body. So, as women, when we start losing our hormones, every single cell gets affected. And as I said, if we were still dying at 50, it wouldn't make a difference because the average age of menopause is 51.
yes,
So, but now we're living up to a third or more of our lives past that stage. So it is now critically important. Now, of course, hormones got a bad rap back at the turn of the century. Well, actually, let's go back even before that. 25 years before that, 1975, that era, they were putting everybody on hormones. Everybody. And we knew then that the hormones was causing things like endometrial cancer and that type of thing. But that was because this was being done. Number one, they were using synthetic stuff.
yes,
Body didn't recognize it. That's number one. Number two, they were doing this without any rhyme or reason. There were no studies, there was nothing to show what to use, when to use, how to use. And they were just giving people estrogen. Now, estrogen as a hormone causes growth. Growth without development is a problem.
yes,
You have to be balanced. And that word is critical, is just as important as vitamin D being the basis of our immune system. You have to be balanced because too much is bad as too little.
yes,
Whatever it is. I mean, I'm speaking specifically about medicine and about hormones and whatever, but think about it. In our lives, everything comes down to balance,
the balance, of course.
cycles, and seasons.
Yes,
Balance, cycles, and seasons. You have to be balanced. And they were just giving people willy nilly, just giving everybody estrogen. All right. So there was all this growth, but there was no development. So they literally, that's what happened. So when they figured out that that's what was causing the increased incidence of things like endometrial cancer, for example, they just stopped.
yes,
And then
yes,
around the turn of the century, in the late 1990s, they said, oh, we got it. You've got to give all the hormones, you've got to be balanced. They started doing that, but they were still giving just the synthetic stuff. Matter
and
of
I,
fact, people still don't know that there are a lot of people, even up to today, on Premarin, pregnant mare's urine. Now, I'm not a horse. I don't know about you or anybody else, but I'm not a horse. Don't
Yeah.
give me horse's urine.
Yes.
Don't give me
Horrible.
horse's urine. Okay? Don't give me horse's urine. I'm not a horse. And the thing is, it was the molecule in the horse's urine was close enough to the molecule in the human body that it helps, but it's not the same. It's not
Yes.
a mirror image. It's not the same. Now, what was found is that the substance that is extracted from the plants, Mexican wild yam, potato, edamame, and soy, and the stuff that's extracted from plants is the exact molecule. It's a mirror image. The body recognizes the stuff from the plants. It still does not recognize the stuff from the horse's urine.
Yes. So the person has to be well informed before they start putting all this
Stuff.
yes, because I was reading somewhere about progressins. I don't know if I'm pronouncing it correct. And that is
Progestin.
progestin, and that is an artificial thing that is
The
bad for
body
your health.
doesn't recognize it. The body doesn't recognize it. So
So
that's where the bioidenticals come in, you
yes,
know. But you also have to understand and realize that even as OBGYN doctors, they didn't teach us any of this. This is
yes,
stuff that I had to go out there and research and learn in the past 20, I started 27 years ago. Now, let's face it, I found it for me because when I started going through menopause, I was insufferable. I could you would see me, the nurses would see me coming. I'd get off the elevator and they would duck into rooms just so as not to deal with me because it was that bad. I was completely non-functional. Completely non-functional. Okay. And I was not going to take the horse's urine stuff. And I started out with yam cream, rubbing yam cream on me and all of that. And I went up the line until I found what we have now, which is the bioidentical hormones.
now something else. There are other advantages for that this bioidentical hormones other than to relieve the symptoms of menopause. Tell me some of the other
Oh,
advantages.
absolutely. Well, as
Yeah.
I said, there are hormone receptors on every cell in the body. So
Yeah.
when we lose our hormones, every organ, every cell gets affected. Your skin, your brain, your heart, your bone. For example, the hormones actually builds bone. I have the orthopedic guys now and the cardiology guys sending me patients because it actually rebuilds normal trabecular bone. It actually rebuilds the bone. People can,
Beautiful.
I have one lady who came in, sent to me by the orthopedic guy, because she could not tolerate the Fosamax and the Raloxifene and the stuff that's out there that they're treating osteoporosis and stuff with, which, by the way, here we go again. These are drugs. They're treating it, and all it's doing is stabilizing the person. It's not fixing the problem. All
It's not
right?
going to the root cause.
Not fixing the problem. She came in and she was very leery. And she's like, my doctor sent me. I want to do this. I can't tolerate this stuff. What do I do? I'm leery about this, but. So she came in. We put her on the hormones. And 3 implantations later, she tells me she wants to repeat her bone density. And I say to her, look, it's only been 9 or 10 months, you know. Um, we have to give it a couple of years. And she's like, no, I want to do it now. And I'm like, they're not going to pay for the test. I'll pay for it. We sent her, and do you know, she had actually, in less than a year, increased her bone density by more than 4%. Okay. And the studies have shown that we can actually increase bone density by up to 8% per year,
That's
up to 8% per year.
that's great. Now, now talk to me about even heart disease. Women tend to, get heart disease, what, between 60 and 70? Or
And again, here we go. If you think about it, you can think of a man who has had a heart attack or a stroke at
Mhm.
45 or 50 or whatever. You can't think of a woman. We don't catch up until 60 and 65 and 70. And that again is because our hormones protect us. So when we start losing the hormones, if you were to replace them, you won't get that problem. You won't get those problems. It actually protects against heart disease,
That's
protects
great.
against Alzheimer's. All right? It
And we
literally,
don't hear about these things. We don't, you know, the bioidentical hormones get such a bad rap that we don't hear of some of the good advantages as the bone density, uh, protect against heart and brain health. You know, uh, it's amazing.
well, not just the bioidentical, it's hormones in general. Because of what happened at the turn of the century, what happened in the late 90s when they were giving people the horse's urine stuff, women were dropping like flies. They were getting more breast cancer. They were getting more Alzheimer's. They were getting, it was because it was the horse's urine. So now that that has been debunked, everybody still thinks about that. Nobody has gone out there and said, because all of that has been disproven. All of that has been disproven. But nobody has gone out there to make it public knowledge.
Yes.
Okay? It's like anything else. When the bad thing happens, they blast it, and then when it's disproven, it's on the 15th page in a paragraph this big in the newspaper. Yeah.
So how do you find doctors? It's very rare to find like you. You're convention. I must repeat, you're conventionally trained. I've been practicing gynecology for years and years, and also you're into functional and holistic medicine, which is such a beautiful partnership. Now, how people could, you could just take what so many uh, patients, how do you, how a woman recognize, go about finding somebody?
You just, what can I tell you? You have to figure out what you're looking for and find the person. I mean, you just have to ask and keep talking to doctors until you find somebody who actually will work with you.
And as you say, listen to you,
Got to listen.
and
Most people
and
just
and,
don't
and
listen.
touch your body to see what's going on,
That is correct. Yes.
now another thing that you do in your office, and a lot of women don't want to talk about it. I have read about 33% of women would go through some kind of pelvic disorder, which is incontinence. And we see all the ads about women. Now we've seen it so often in commercials, people laughing, and then they have these ads for uh, pads and everything. You do something in your office. Talk about that.
Okay. A lot of times, and some of it is just with age, but some of it starts usually like after delivery.
Yes.
The tissues get weak, and yeah, women lose their urine if they cough or sneeze, or bladder gets too full, or that type of thing. So whether it's stress incontinence, where you lose the urine when you cough or sneeze, or it's overflow incontinence, or whatever, we can actually fix it a lot of times, non-invasively.
I like that word, underline.
You don't need an operation.
Yes.
Okay, it's and it literally It rebuilds the tissue, but it's not painful and it's completely non-invasive. All right. So we do what we call vaginal rejuvenation with a radio frequency machine. Now it can also be done with a laser. I did not buy a laser machine. Don't do it with laser because what the laser does is the laser actually breaks down the tissue to build it back up. Whereas with the radio frequency, which is just heat, it does not break down the tissue. Okay? The laser is ablative. It destroys the tissue. And then over time, the tissue grows back in, which it does. But it just didn't make any sense to me to destroy something to get it when you can do it without destroying it. You know, so it really, it's amazing. It really works very, very well. It's called rejuvenation and it's non-invasive completely. I've had people sleep through the procedure.
Wonderful, wonderful. And these are things that the regular gynecologists don't tell their patients, you know?
Again, most of them don't know. This is the type of thing you have to look for to find. How's that? You really, and that's one of the problems. It's one of the things you have to look for to find.
Now, I wanted to, someone sent a question to me. She has fibrocystic breast disease, you know, and she wanted to find out how to deal with it and how to go about monitoring it because, you know, you don't want to ignore it and then you feel something and it's something else. So, could you speak a little bit on that?
Okay. Fibrocystic breast disease, actually, you can, how do I say, it's not dependent on, but it's also related, can be related to hormones.
Yes.
All right. It's not dependent on, but it can be related to hormones. It's also related to nutrition and lifestyle. So when you put those two things together, how you deal with it has to do with those three things. All right. You can actually, you can't, it's not going to get cured, but it can definitely be controlled. Now, how do you monitor it? Number one, you've got to know your body. I tell people all the time, for example, even with breast cancer, most lumps are found by the women themselves. So if you look, let's say, once a month, now while you're in periods, it should be done right after your period. When you're menopausal, it should be done. Pick a date, the first of the month or the last day of the month, whatever. And you get to know your body, examine your breasts so that if something changes, you can know sooner rather than later.
Yes.
You know, that's how it's monitored. The other thing that I have is called thermography.
Yes, that's a good thing. Yeah.
Which actually, it's again, the test is based on heat and it picks up inflammation anywhere in your body because the basis of everything, including cancer, is inflammation. Matter of fact, if we were to get rid of the vitamin D deficiency and the inflammation that we see as physicians, more than 50% of what we treat would disappear or not happen. Those two things, vitamin D deficiency and inflammation.
So, like even when people do their blood test, they should really
Look, you gotta look for inflammation. There are lots of tests out there. I do 5 specific tests for inflammation. 2 of them for general, 1 for cardiac, 1 for muscle. You know, and it's there, it's available, but you have to do it. You have to look for it.
Yes. And I guess you have to be really assertive and proactive about your health because even if you go to a regular doctor and they not, now that you're informed, when they send you for a blood test, you really want them to
You tell the doctor, doctor, I want you to check my vitamin D level and I want you to check me for inflammation. You tell the doctor that. They're all hung up on cholesterol. Guess what? Cholesterol is not a problem. Cholesterol is not a problem most times. All right? Because cholesterol is a necessary molecule. As long as you're not inflamed, it doesn't matter how high your cholesterol is. Because as long as you're not inflamed, it will just pass right through. If you are inflamed, that's when it sticks. Okay? Because if the vessel is inflamed, that's when,
yes, wisdom. Now, I wanted to ask, this is another question. Before you touch on other things that you do at your wellness restoration center, sometimes women have symptoms, that going on with their health. What symptoms that they should really need to pay attention to get help? Don't just ignore it. What are some really
well, the way to answer that is to tell you that anytime there is a change, it needs to be addressed. How's that? It
yes,
really is that simple. If you notice that something has changed, whether it's a mole, a skin lesion, whether it's the fact that now your ankles are swelling, whatever it is, whenever something changes, it needs to be evaluated and addressed. It really is that simple.
hmm. So we
That's it.
need to be,
I can go into 50 different things, but I don't need to.
yes. So in your health
Something
issues,
changes, check it out. Something changes, check it out. Half the time it's going to be nothing and you're going to be fine. But there's only one way you're going to know.
yes. And I'm so happy that you are my gynecologist. And I remember I'm being very candid. Something, and I called the office. You were not in the office, but you got back to me right away, and you said, "Get this done, get this done," and so that you know where you are. So I thank God for your sensitivity and you know paying attention to stuff so that we don't just go for months and months. So I'm happy that you are. Now, there are other things that you do in your office. I want you to talk about that could help women. There's something, you do weight management, you do sexual wellness. Speak a little bit about that. Sometimes people don't want to talk about these things, but deep down in their heart, they want answers. So you share a little bit before we finish here today.
Okay. Now, there is my website, no one wants to talk about it.com.
you, you,
Okay. Because and that's true. It's thick. We sometimes, not sometimes, a lot of times, and men maybe even more than women, because a lot of times we women are the backbone of our families in terms of everything, including health. We are the ones who will agitate and get, our children, our husbands, or whatever, to do what needs to be done and to check things out. But sexual dysfunction is something which is rampant and which, again, a lot of people don't address. And it's important. It doesn't make sense to not address it because if you're not going to be able to get rid of it, take care of it, etc., unless it's addressed, you
Yes.
know. And I now treat men, as you know, as well as women, because the women started coming in saying, "You fixed me. Can you please fix him?" you know. So I went out and took all the courses and got trained, um, to take care of everybody, the whole woman, but also the whole man. So, yes, I treat erectile dysfunction, and again, non invasively, and it really does work. Um, and everything else in women, not just hormones, but orgasmic dysfunction. For example, we have what's called an O shot, which is where we put stem cells or PRP or whatever into the clitoris and the anterior vaginal tissue to basically bring back the cells, So
Yes.
revitalize and regenerate them. Okay. I also take care of pain with a machine. It's called a stem wave machine. And basically, let me just touch on this a little bit. Stem cells, and I know everybody's heard of stem cells, and that's the future of medicine is stem cells. Now there are different ways to use it and to do it. One of the ways is with where we actually get our bodies to bring out and produce of our own stem cells. Now, stem cells, I can get you umbilical stem cells or mesenchymal stem cells or even stem cells they take out of, like I'll suck out 2 or 3 teaspoons of fat and they'll process it and expand it and get the stem cells from that. But that stuff is expensive. So
Yes.
for most people, for the man in the street, we can process it from your blood, or
That's
we can
wonderful.
we can actually do with this machine, get your bone marrow and your liver and your body to enhance and bring out your own stem cells. And
That's
it's
amazing.
something everybody should look at.
Yeah, definitely.
Everybody should look at, because when it comes down to the nitty gritty, when it comes down to it, even I don't know, there was a time when we were saving cord blood, right? And that can be used for up to a second generation relative. It can be used for mother, father, sister, brother, child, whatever. But it can, I mean, even cousins, all right? It can be used even for second generation relatives. And now it's important in the treatment of cancer and all of the above. I mean, this is the future of medicine. Another thing that we're now doing, which I am so excited about, is being able to check your DNA, check somebody's DNA to tell what medicine they should or shouldn't take, and what's going to react well with them and what's not. And I mean, it is so exciting. It is
It
really
is.
exciting, because there is so much we can do now that you only dreamed of in the past.
And,
It's exciting.
as the Bible says, knowledge is increasing, and we want to know, not have that knowledge, because knowledge is power. Things
Yes,
that we didn't know about 10 or 20 years ago, now it's here.
it's
So
here. It is definitely here.
So
Yes,
I want to thank you for coming on and sharing knowledge with us. But I want you to take this time and, just tell people where your office is. We talked about some of the things that you do in the office already. Anything else you want to share, and tell them how they could reach out to you.
Okay, thank you. The only thing I want to say is that what I do is take care of the whole patient. I actually listen. And trust me, I don't know everything, but what I don't know, I know where to find or I know who to send you to. Okay? So basically, I tell everybody, let me be your quarterback. Okay? Let me be your quarterback. You come on in, I take care of the whole patient. And that is because I listen. Okay? I listen. And which is the basis of good medicine. All right? I listen and I try to find the root cause and to prevent. Those three things. I mean, we're talking about things that are critical. My office is the Wellness Restoration Center. We are located at 425 Madison Avenue, Suite 1602. We're on the 16th floor, right across from the elevators. And the phone number is 646 478 9833. That's 646 478 9833. Also, the website is drmarciaharris.com. And if you don't see it there again, I listen. And if I don't do it or can't help you directly, I guarantee you I can know where to send you so that you can get this taken, whatever it is, taken care of, or at least prevent so that it doesn't happen in the first case.
It's beautiful because we know an ounce of prevention is better than a pound of cure. And we want to be proactive and take, I call it preventative medicine, you
Yes,
know.
yes.
So, Dr. Marcia, I want to thank you so much for taking the time from your busy schedule to come on and share such
It
knowledge,
was my pleasure.
such knowledge. And I thank those who came on. And I know there are people going to be looking at this video afterwards, and they're going to be really be thrilled and blessed by the information that was shared. And it's all about being wonderfully whole. God bless. Until the next wonderfully whole conversation.
Thank you.